Greetings. I'm Precia Stuby, the Executive Director of the Alcohol, Drug Addiction, and Mental Health Services Board. I just want to talk a few minutes with you today about mental health. During this unprecedented time of what we're calling COVID-19. The first thing I want to say is that this is a traumatic event. It's an event that we are all experiencing. So what we want to do is bring a little bit of the science of trauma to our community so that we can figure out what's the best way mentally to get through this. The number one rule related to trauma is safety and security. So anything that we can do that helps us feel safe and secure are the right steps. But I want to go through 4 very specific things that you can do. The first is to make sure that you are validating not only your feelings, but the feelings of those that you love. Feelings are not right or wrong, they are what they are. So if somebody tells you they are afraid, validate, I understand that you're afraid. If they're angry, validate, you understand that they're angry. Don't tell people what they should feel or that their feelings are right or wrong. Validate the feelings that they have. The second thing is to look and help to take inventory of what you can and cannot control. In this environment, there are things that you can control in relationship to COVID-19. You've heard many examples of that. Wash your hands, physically distance yourself from people, cough in your elbow, stay home if you're not feeling well. Those are all things within your control. Those things that are outside of your control, they're just that. Things you cannot control. Try and focus on the things that you can control. It will help you stay calm. The third thing is to maintain or create connections. Make sure that you are physically distancing, but not socially isolating. You can still talk to people, whether that is on the phone or electronically. There's all kinds of creative ways that people are finding a way to stay connected. And finally, self-regulate. Now I know that sounds like a strange word to people. What does self-regulate mean? Self-regulate means that you know how to calm yourself. What helps keep someone calm? So for example, for youth, some things that help them are routine, self-care, like brushing their teeth, getting dressed, making their bed, having time to play, time to read, things that will just help them when they're feeling a little unbalanced, get back into balance. For an adult, that might be things like yoga, meditation, walking, things that help you stay calm. So when you feel like you're getting a little anxious, or you're not sleeping as well, or your eating habits are different, try and get back to some form of self-regulation. Find something that works. Again, there are ways to be able to access help with that online, even if you can't go somewhere. If you can't go to a yoga studio, you can watch online some different ways to do that, just like with meditation and so on. And finally, I want you to know that services are available. Now, they might not be offered in the same way that they have been in the past. Most services right now are being offered electronically. In some situations, when necessary, they are still being provided face-to-face. Just remember, different can be good. Remember the days before the internet, the days before we had texting, and now that's incorporated into our daily lives and we don't fear it anymore. In fact, we actually like it. Don't be afraid to try an electronic service. Resources for mental health and addiction services can be found at the Hancock County, it's called Hancock Helps website, and also at the website yourpathtohealth.org, where we have an electronic resource guide. And if necessary, always feel free to contact emergency hotline numbers if you're in need of help immediately. With that, I'd just like to say, take care of yourself, take care of your family, and be well. Thank you.